Okay, Andrea, tell me, what was it like 20 years ago when you opened the doors at Lucile Packard Children's Hospital?
It was really exciting because we'd had, a lot of anticipation to it, a lot of build-up. Actually, the first few days before we opened the doors were difficult because we had to come and tour the unit and see what was going to be happening here, and the times that we were doing our tours they were bleeding the oxygen lines and had incredible noise going through the hospital, but we got to see the basic layout. When we actually opened the doors, it was like 2 years of anticipation coming true and getting to leave a really old and funky unit and getting to be in something brand new and clean and exciting, and it was thrilling to have beds for the family members and a lot more space. It was challenging trying to find things like a box of tissue for your patient. I started my first shift. I wasn't in the crew that made the switch from 7. It was at 7 a.m. I think we made the switch, and I worked the very first night shift after. So the day shift had all been in there, and talking to those day shift nurses, they were saying, telling us the challenges that they had, and it actually was, I thought, very, very smooth. But it was just kind of like being at a party because it was so very different. And everybody's just very excited.
Jeri, what are some of your memories?
Well, I was part of the crew that was working in that morning when we were moving, and one of the things that was challenging is that we still had patients coming in. We couldn't close just to move the units, so depending on where patients were in their labors, we'd either keep them in our old unit and have their babies there and then move them to maternity, or we'd bring them over to the new labor area. So we had a set of nurses working in our old unit, and then we had a set of labor nurses working in the new unit. So we'd bring patients over and introduce them to their new nurse, and then we'd go back to the unit and handle, and we had to stay open like that for a good 12, 18 hours because the patients didn't know that we were moving either. It was nice to get over closer to maternity since maternity had moved right next door to Packard previously, and we'd been moving our moms after they had their babies up the ramp and over to the new building all that time anyway, so it was really nice to get over close to them. The NICU also was moving, so we were kind of doing everything at the same time, trying to coordinate where babies that might need NICU care should be born, whether in the new unit and the old unit. So a lot of challenges, and I think we did it pretty well. It was a lot of fun.
So tell me how far we've come in the Johnson Center for Pregnancy and Newborn Services.
Well, we have a lot more patients that we deliver now. We have become, instead of being Stanford employees renting space in Packard, we're now Packard employees and part of Lucile Packard. Becoming the whole Johnson Center was very exciting and different. This has just always been a very special place to work, very special place to have a baby. I actually had my children here before I came to work here. My sister delivered her children here, and every experience was so fabulous. I said, I have to go work there. And so I did. I came.
It is a great place to have your baby.
It is a great place to have your baby, and we do it well. At least we think we do. It's been fun being part of Packard in that when we first moved over, it was a very different environment than being at Stanford, and we kind of joked about Packard was a small town community. Everybody knew each other, and we came from the big city, and so it was kind of moving us into a different environment and having Packard kind of accept the environment that we came from and integrating the two. And those were a few challenging years as we made that happen, but it's turned out very well. Johnson Center has delivered about 5,000 babies a year, and we get moms from all over Northern California coming here for our specialty services, so it continues to be exciting.
So how do you feel about the 20th anniversary?
I'm looking forward to it. I'm going to be participating all day, starting the very morning walking and working in 2 booths, and it'll be fun to see the community as they come and take part in it. It's kind of ironic that the 20th anniversary is happening just before we're going to be able to break ground on the new part of the hospital. So,
20th anniversary wishes.
Happy birthday, Lucile Packard.
Any happy birthdays?
Happy birthday.